Thanks for connecting and welcome to the Geneva Macro Labs online talk, Global Health Response at the Crossroads. My name is Renate Günther and I have the pleasure to be the co-founder and the vice president of the Geneva Macro Labs. I will be moderating this online talk today together with our president, ACT Ernst. For those who don't know the Geneva Macro Labs yet, we are a do tank providing a platform, for example, through these webinars to scale the Lake Geneva area's intellectual potential and to bring leading minds together from the public and the private sector, as well as from civil society. Our mission is to support the sustainable development goals of the UN out of Switzerland. So what's on the agenda today? I will share my screen again. So we will have two presentations. The first one about COVID-19 and fragile countries by David Verboom, the CEO of Medair, and the second one about global health actors joining forces to combat COVID-19 by Michael Borowitz, who is the chief health economist of the Global Fund. So before we start, some housekeeping rules. You have the chance to comment or to add your questions to our chat tool already before the Q&A. You can do that during the presentation already. You can find the chat tool on the bottom of your screen. Very important, please mute yourself if you are not presenting in order to avoid possible background noise. This webinar will be recorded so that you can review it in case or send the link to your network. And the video of the webinar will be available later this week. Before I hand over to our first speaker, I have a question for all of you. In which country are you currently located? Please comment in the chat tool so that we can understand how international our audience is. Thank you in advance. We have the chance to now listen to our first speaker, David Verboom. David worked for almost a decade at the European Commission Humanitarian Aid Office before he became the National Director of the humanitarian organization World Vision. In 2018, he took over the role as a CEO of the Swiss medical humanitarian organization Medair, which is headquartered in Lausanne. In that capacity, he is responsible for humanitarian and development programs in Asia, Middle East, and Africa. David, may I ask you to unmute your microphone and share your presentation? You have the floor.
Thank you, Renata, and thank you so much for inviting me to be with you tonight at the Geneva Macro Labs. And very nice to meet with everyone virtually, online, with such an international company. And yeah, it's great great topics to discuss. So indeed, as Renata said, I want to give you an insight of what Medair is doing in this major, unprecedented pandemic that we're all facing. Medair, a Swiss-based humanitarian health agency. For those that don't know us, we work in 12 countries, and our mandate is to go to the most difficult places in the world and to provide assistance to the most needy people. Let me share the presentation with you, and we will go step by step. Can you see it? So when Medair, as a humanitarian response agency, we have global, what we call GERT, Global Emergency Response Team capacity, and these are people over the world. We have a total of 1,700 staff, and the GERT is really our front runners, and they are responding to any emergency. These are mainly senior health advisors. So when the pandemic started to evolve, we set up the task force, the GERT team. While we work in these 12 teams, the GERT team has a as KPIs that within 24 hours we're on the ground wherever there is a crisis, and then within 3 days we will do an assessment, and within the first week we will respond. So for this COVID-19, we immediately set up the task force and started to, of course, liaise with partner organizations, WHO, MSF, so many other health agencies responding globally. And then specifically in the countries where we're looking, while global guidelines were and global approaches were being developed, we adjusted them to the 12 most vulnerable countries that we're working in. And these are countries like Syria, like Yemen, Afghanistan, Congo, Madagascar, countries, I will talk a bit more about it later on, where you find, according to the UN, OCHA, the people that are dependent on humanitarian aid. Then, of course, we had to take care of our staff. This is the last bullet point. You cannot support people in need if you don't take care of your own staff. So immediately, we had to support our staff with access, but also with isolations. We had a few cases ourselves and had to deal with that. Then, as Antonio Guterres said, the health catastrophe makes clear that we're only as strong as the weakest health system. And as we're working in these very vulnerable countries, our aim was immediately to scale up our current activities to support, first of all, the basically community mobilization, had to educate people. To give you an example, in Congo, we were just finishing actually the Ebola response, and some of the last patients were dismissed. It's not completely gone, unfortunately, but as soon as it looked better, we got the COVID-19 response coming in, and the virus, and people being affected. One of the key, similar as in Switzerland, one of the key things to address is community mobilization and sensitization, making people aware of what they need to do, and informing people to keep distance if there are cases, what are the symptoms, to self-isolate. And of course, in these countries, you don't have governments like the Swiss government that inform you beforehand, that give you the scenarios, that communicate through TV and other means. So it's down to NGOs and UN and Red Cross agencies in these very fragile and volatile environments to communicate and get the word out. Of course, this to aim the reduction of the COVID-19 and to prevent further spread. Then when cases are confirmed, we support the health systems to cope with it. And yeah, in these countries, you have malaria, pneumonia, TB, and as I already said, Ebola, like in Africa, and so on top of that, you have COVID-19. So it's very hard for these systems, health staff, to cope with it. No equipment, not sufficient staff. So that's a strong focus for us to train, to develop, to be present in these clinics and these hospitals. And the good thing that we have seen in many countries is that the governments, even though there are restrictions, as you know, the pandemic epicenter moved from Asia to Europe to the US, but also in the Middle East and Africa, it's increasing, and also the restrictions are increasing. But as frontline medical workers, they provided us access to camps or to the clinics and to hospitals to support them. Here you give an idea of the lack of health staff, to cope. I mean, we have problems in Switzerland, but imagine even more in those countries where there's so few doctors and nurses available. And then also, in addition, as you can see here from this overview, is the critical care beds, the IC beds. intensive care units that are available in Switzerland, 110 per million inhabitants, and you see it going down with South Sudan, basically none available. So that's why the community mobilization, and then also the triage at the clinics at the hospital to find out who has the symptoms and who needs to be isolated is so important, because if they get to a critical level in these countries, they don't have the ventilators or the support systems that we have in the West, like in Switzerland. Then even more critical are the camps, and this is a picture of the Rohingya camp in Bangladesh. Yeah, unfortunately, with the work of many agencies that are there, and also the UN and the Red Cross, there's only been a few cases, and we have been able to keep it limited. But of course, this is now the biggest refugee camp in the world, and there are also many camps, as you know, in Africa and also in the Middle East. So essential for us to support people. I mean, if even in cities the distancing is already so difficult, imagine how it is in these camps like this, as it's indicated here, 40,000 people per square kilometer. Then with it, as the health crisis, and we all see that globally, it starts with a health crisis, but then you have a financial crisis, and so much stress in our countries, like in Switzerland. You know, people are temporarily maybe put on unemployment or have to work less. Some might may even lose their job, which is terrible. But in these countries, and many people, actually poor people, they rely on casual labor, and so when they lose their jobs, which is happening for so many, they basically you know, face a famine. They will not be able to have food for their children, and so, you know, out of that health crisis, there's so many more stress and fear and anxiety coming out. For example, in the camps in Lebanon, we'll come back on an example in Lebanon, where people have already just, you know, been chased out of their country, Syria, and just have been able to survive. Now to have to face this in a crowded camp. So major traumas. So a focus for us is also providing food and assistance. As I said, WFP has indicated and has recently said that they believe, according to, or with COVID-19, the people that are facing chronic and acute hunger is doubling in the world. Currently, it's around 135 million, and WFP is expecting it to double, which would, you know, almost, well, be more than 250 million people brought into acute hunger because of this disease, and basically, you know, everything that follows out of this crisis. So then to finish, yeah, as someone has said, limitations lead to innovation. And Medair is an organization that in the humanitarian sector, sometimes we feel the humanitarian sector can be quite, can be a bit reserved, maybe sometimes old-fashioned, as it's called, to innovate. And it's so important that also the humanitarian sector innovates, and limitations lead to innovation. And definitely we have many limitations currently. And it helps us, we find it helps us to innovate more, to push innovations through, and to look at things in a different way. To, of course, we're going to face the new normal. How can we, as humanitarian sector and agencies, respond to it? So it's important for us to build on the innovations that are out there in the field, to multiply it, to provide the support for the organizations. And we have here an example in Lebanon, where we do mapping of where the refugees are, and now also the mapping and identification where cases are, and then following up. This is then used by the UNHCR, who's the coordinator in Lebanon. You can see here the picture. It's all virtual mapping with drones also. And this allows us to support the humanitarian community to find the appropriate responses to getting. Lastly, I already talked about the importance of food security, and an important approach is cash. Instead of giving items, giving people cash, so that refugees, people in need, have the dignity to make their own choices. Again, something that we have been pushing, but now also working with the digital follow-up, monitoring and evaluation. We work with iris scans for people to get these funds, and then we can trace it. The digitalization is getting a new push because of COVID-19, and that is quite amazing to see. So with that, let me finish, and thank you for your attention.
Thank you so much, David. That was really eye-opening, and I find it fascinating, this project that you are doing currently, where you are following the refugees with the drone. So that's really an innovation that we need in these days to better face this kind of crisis. I have now the pleasure to hand over to our next speaker. We have the chance to listen to Michael Borowitz. Michael was a senior strategy advisor in the UK Department of Health before he became senior health economist at the OECD in Paris. Michael is now the chief health economist at the Global Fund in Geneva. He's responsible for health financing, cost effectiveness, and market shaping. In his role, he's the relationship manager for the World Bank, the WHO, and the Gates Foundation. Michael, may I ask you to unmute your microphone? I will share your presentation now. Michael, you have the floor.
So thank you very much, Renate, for having me. And I think just as a segue to what we have been discussing before, I'm shifting from humanitarian assistance to more traditional development assistance. And I'm going to talk about the role of the Global Fund and the other international architecture around the response to COVID more generally. And if we go to the next slide, I just wanted to, Renate, if we go to the next slide, yes. I just, for those of you who don't know, I just wanted to spend a little bit of time introducing you to what the Global Fund is. But then I wanted to start at quite a high level and see how the UN system and the Global Action Plan for Sustainable Health Financing is responding to COVID and the multinational funding agency response. And then to give a more specific example, drilling down to the Global Fund of what we're specifically doing on COVID. So if we go to the next slide about the Global Fund, for those of you who don't know, the Global Fund, the slide before that, the Global Fund was set up in 2002. It was a response to an AIDS pandemic in a way similar to the COVID pandemic, and it was felt that the UN system was not responding. The UNAIDS was created outside of WHO because it was felt that WHO was not actually adequately responding to the AIDS crisis. And subsequently, the Global Fund was created, as were other global funding agencies like the Global Alliance for Vaccines and Immunization, or Gavi, which was funded. And originally it was outside of the UN, though part of the UN system, and now the Global Fund is a Swiss foundation. So if we go to the next slide. And the Global Fund is probably the leading funder for AIDS, tuberculosis, and malaria. We just had our replenishment. We go in 3-year cycles, and our current replenishment was for $14 billion. We spend between $4 and $5 billion a year on these 3 diseases, about half of it going to AIDS and the rest split between malaria and tuberculosis. Although we're a big funder of AIDS, the largest funder is the US government through the PEPFAR program, which Debbie Birx, who's now the COVID coordinator in the US, used to be the head of, or is still actually the head of. But interestingly, even though we are a very important player in AIDS, and that was one of the driving forces in the establishment of the Global Fund, we are the largest funder for both tuberculosis and malaria. If we go to the next slide. And just to understand how we work, so the Global Fund raises, spent about $4 billion a year, and it goes through a specific coordination mechanism at the country level, which is called the Country Coordination Mechanism. And interestingly, that actually includes civil society. So although we work with governments, we also work directly with civil society. And then we often implement through different local implementing agencies, which often may very well be NGOs, including government, and then have oversight as well through an independent agency, usually often sort of like an accounting firm. If we go to the final slide about the Global Fund. So the Global Fund has had a big effect on these diseases by investments. There's been dramatic declines in the deaths for both tuberculosis, AIDS, and malaria, which now I think are under threat because of COVID. So I think that's very important because we and Gabby and all the other partners that are working on specific disease areas are face very difficult issues now with the rise of COVID. So if we go to the next slide. What you can see is that COVID as a cause of death is creeping up, actually. So tuberculosis and AIDS are still higher causes of death, but COVID may very well surpass them. And probably more importantly, COVID could disrupt access to essential services like basic immunization, which would mean that you could have outbreaks of things like measles, rampant malaria, which would kill many more people. So the potential disruption of COVID to essential services is one of the things that concerns us most to maintain essential services, which is basically primary care and community health workers. If we go to the next slide. So now if we just move up to just say that from the Global Fund and where the Global Fund fits in the global architecture, currently there's something called the Global Action Plan for Sustainable Development. It's hosted by, the Secretariat is hosted by WHO. It was initially set up under the impetus of the German and Norwegian governments asking how global health agencies would work together to achieve the SDGs. And they set up something called the Accelerator, and there are actually 7 accelerators that were established, hosted by different agencies, including sustainable financing, but as well as primary healthcare and other things such as research and development and social determinants. If we go to the next slide. But one of the most active, or the most active accelerator, partially because it's old wine in new bottles, which is collaboration across the Global Fund, the global health funding agencies to coordinate around health financing. And that's generally those organizations that provide direct funding into the health sector, particularly the World Bank, but also the Global Fund and Gavi. And the new person is the Global Finance Facility, which is hosted by the World Bank, which works on maternal and child health. And finally, the World Health Organization, which has a stake in this around health financing. So those are the principal organizations involved in the Sustainable Health Financing Accelerator, which has been the most active accelerator working on sustainable health financing. And because that collaboration was going, when COVID came, there was a significant shift to try to take into account what the implications of COVID are. So if we go to the next slide. So one of the things the Sustainable Health Financing Accelerator has been doing is putting together information about 4 countries in particular about how they can act and what funding they can access from different channels under what circumstances for COVID, because there are many different possible funding agencies, including the Global Fund. And if we go to the next slide, so we reviewed and are continue to review all the activities of all the major organizations funding, including the World Bank, but also all the regional development banks as well, including the Global Fund and Gavi. And just to give you a flavor for the kind of analysis that's available, if we go to the next slide, it goes through how countries can access funding. Particularly, here's a case from the Global Fund, and I'm going to talk about this briefly in a little bit later, but it explains the eligibility because, for example, from the Global Fund, if you make a good case, then you'll be most likely be able to get it, but it's more likely to focus on things like maintaining essential services and basic PPE for frontline workers and testing and stuff like that, rather than larger ticket items like ventilators and oxygen, and support for intensive care units and hospitals, which would generally come from the World Bank. And if we go to the next slide. And then it just explains like how the process works and what they need to consider, and provides information for all of the links to how to access information on the Global Fund. And so this has been very useful to different countries, and there's now been a lot more demand from countries accessing funding. And if we go to the next slide, in addition to capturing information about eligibility and funding, we're also providing a clearinghouse on information. Here's a clearinghouse of essential tools that are available, particularly forecasting tools for countries to allow them to forecast essential supplies like PPE, but also intensive care unit beds and various other things using new epidemiological models. And we provide, next slide, we provide information on all the different resources available, including the IMF, which is providing very interesting tracking information about what's going on in COVID. So if we turn to the next slide, I just now wanted to cover what the Global Fund is doing. So, so the Global Fund has the eligibility to repurpose 5% of its existing funding, and then 5% of future funding, as well as a new pot of money that's become available for COVID. So now we have approvals of over $100 million, and that's growing rapidly, and requests from 70 countries. And there have been very rapid decisions made on providing funding and making funding available. So, and generally the funding follows what WHO is requesting. A lot of it, if we go to the next slide, a lot of it is around essential commodities for frontline health workers like PPE, potential use of diagnostic tests. For example, COVID testing is available through Gene Expert. You can put a COVID cartridge in there, and so we're working a lot on diagnostics together with the consortium. And then just to finally finish on donor collaboration. So I think that there's a lot of active collaboration, but it occurs at the country level. I was just on a virtual mission in Pakistan, and we have a lot of collaboration. I think Pakistan has been actually really an example of very excellent coordination. Pakistan now has a $200 million World Bank loan. It's going through the existing World Bank loan for immunization, and it covers most of the core commodities. And now we're in discussions about how to maintain essential services in sort of a second package that's under preparation from the Global Fund in collaboration with Gavi and the Global Fund and the Gates Foundation, all working together. So I think that as was pointed out before, sometimes crises can have some positive benefits, and one of them is to encourage collaboration across partners in this trying time. So thank you very much.
Thank you so much, Michael. It was really encouraging also to see the work that the Global Fund is doing, and also this Health Accelerator. So I'm confident that we will see some good results coming out of this initiative. I can also already see 25 comments in the chat box. Now is the time where you can ask your questions, where you can comment. You can either use the chat tool or you can speak out. I'm handing over to my colleague and our president, Eckhard Ernst now, who will be moderating the Q&A and open discussion.
Yeah, thank you, Renate, and thank you very much to both speakers. Very fascinating overview of your activities and what's going on also in the current situation and the current challenges. It's my pleasure now to moderate the Q&A. As Renate was saying, I mean, please feel free to post your questions in the chat box, and then I will either ask the questions or summarize some of the questions that we have, or will give the floor to some of you directly, depending on how the questions flow in. One question that we got in from Marianne already, and I think that's something that I would like to share with both of you, is, and I'll get the view from both of you, is what about pandemic preparedness, in a sense that are you also working in terms of trying to assist countries in helping them to anticipate some of the challenges rather than to react to them? Maybe Michael, you can also give us an example on how your activities work on the ground, and kind of blend that question on the preparedness into such an example.
want us to answer that now, or did you want to take some other questions?
No, I mean, please go ahead.
Okay.
Yeah.
Well, so pandemic preparedness, I've been working on that for a couple of years. So I think there's a lot of things to say about that. So what I would say is that after Ebola and even after SARS, there has been a lot of progress made. So the passage of the international health regulations and the creation of the joint external evaluation have been very useful. So if people don't know about that, then there's a new system of regulations. It's the regulation that allows WHO to declare pandemics and some of the implications around that. And then countries are supposed to do an assessment of their preparedness for pandemics. And you can go onto the website and find these kind of peer reviews. Sadly, well, I guess there are two things to say about it. I mean, the first is that sadly, many countries, if you look at these reports, are ill prepared for pandemics. And although there's been some investment, there's been inadequate investment, particularly in certain areas that, to be honest, many of them outside the health sector. So if you think about COVID, it's a zoonosis. It's an infection that started in animals and then transferred to humans. So one of the critical things around pandemic preparedness is animal health and the relationship between human and animal health. And so I work mainly in the health sector, but pandemic preparedness means also embracing this one health concept, which includes animal health, and that is really underfinanced in all places, but particularly in low and middle income countries. But even beyond the animal health component, sadly, surveillance, which is, as people have probably seen from COVID, one of the most critical issues in responding to COVID is generally underfinanced, but not just in low and middle income countries, in all countries, sadly enough, including high income countries. And we see that the consequences of that in many high income countries that are not able to carry out contact tracing. So yes, I think that's a very important question.
Yeah, thank you. David, what is your experience? I mean, you work mostly in fragile countries in any case, so can you give us a bit more on from your side as well?
Yeah, no, thanks. I mean, indeed, in the places we work, the governments are unfortunately busy with other things. Giving an example of a place like Yemen, where you have around a bit more than 20 million people, and according to the UN, 70 to 80% of people are completely dependent on humanitarian aid. And so the governments are busy fighting and not capable, don't have the capacity to provide health services. And so the people basically rely on humanitarian agencies to provide the support. Of course, it's very important for us to, even though the government structures are not there, to work with the local capacity. And so from day one, wherever we are, so all that we do also now in COVID-19 is train national staff in Yemen or in Afghanistan, wherever we are, train them and help them to be better prepared next time. And also provide indeed the equipment, the resources to respond themselves and to build the local capacity. Because whatever you invest, if you invest in training, even if people have to flee, even if there's a conflict, investment in training is never lost.
Absolutely, thank you. Maria Guevara, I think you had a question. If I can unmute you and you can ask your question yourself.
Yes, thank you so much. First, thank you for this opportunity and for running this webinar. I actually had a question for David and maybe a couple for Michael. So David, I just wanted to know, with the health crisis that we're facing and obviously very much becoming a political and socioeconomic crisis, how are you ensuring your funding flow is secured as an NGO? And maybe the first question is, where do you actually get your funds? And then to Michael, thank you as well for your overview of Global Fund. Can you just elaborate a little bit more on this new ACT Accelerator that's being pushed as a multilateral platform for funding for COVID? And what insurances do you think needs to be in place to ensure that there is no diversion of already weakened health systems to focus only on COVID and miss the gains that HIV and TB programs have made? And then is there or will there be any kind of clauses that would look at sustainability and green focused projects, considering there is more and more relationship and talk between COVID and climate change? Thank you.
Yeah, David, if you want to start first and then we give it to Michael.
Yeah, thank you. Yeah, so indeed, I think many non-profit organizations are comparing this crisis maybe financially to the 2008 financial crisis, when fundraising giving was, reductions of 10-15%, also because of the global recession. The good thing that what we have seen is, even though indeed private funding from private donors will be affected, we have seen governments really step up to the plate. And for Medair, 70% of our income, our annual budget is 19 million, is coming from government. So the Swiss government, SDC, ECHO, OFDA, DFID, and these governments have really, besides supporting their own private sector in their country, they have also increased humanitarian support for this COVID-19, and also, of course, supported WHO and other international initiatives. So that's good news. In addition, we have what we call people to people. We very much, in order to reach, we are reaching almost 4 million people in need, and to do that, we are engaging almost 500,000 people in Switzerland. So it's also an opportunity now for us as a humanitarian health agency to inform people and to create awareness, while of course we are slowly moving away from the shock in Switzerland, and then informing people what's happening in other countries where facilities and opportunities are so much less than in Switzerland.
Thank you.
I hope that answered the question.
Yeah. Thank you. Michael, to you.
So first on this ACT initiative, which is this big new initiative, I think hosted by the French government and the German government, I think it has several different components. One is coordination around vaccine development. And I saw there was a question about the vaccine development. So I think this is an attempt to, there's also a component around diagnostics and making diagnostics available for low and middle income countries. But in addition to that, there are other components as well. So I think that's a work in progress, because I think that's going to be, and I think you said, how can you ensure that it doesn't just go to COVID, but that it also goes to broader health system strengthening? I think that that's a very important issue. I think there's increasing belief that there's a need to strengthen the core health system, particularly primary care and community health workers, to maintain essential services like vaccination. And that brings together many of the funding partners like the GFF, the Global Fund, and Gavi. And so there is like quite a movement around this kind of maintaining essential services. But I think that's a very useful point. And I think it's also useful, as people have pointed out, to think about some of the areas that require greater long-term investment that would prevent a future COVID, and that would be investing particularly in some of the core public pillars of the COVID response, which includes surveillance and national laboratories. But there are many others, as well as, risk communication with the population and connections with civil society. So I think it is an opportunity to work more systematically on many of these issues that are common across different pandemics.
Thank you. I actually had a question on bouncing back on what David was saying at the beginning about educating communities. Can you give us a bit more your experience on how you managed to do that in the particular situation of COVID, and maybe a broader issue of what your experience was also in the past. I mean, we have seen, including with cases like Ebola, also that was sometimes really difficult to get the relevant information to communities, and we see that even in advanced economies, that sometimes it's very hard to convince people to take the officially announced information serious. So, I mean, what's your experience? How did you go about this, and how did you involve civil society in this particular aspect?
Yes, thank you. Well, as an NGO, we're part of civil society, and of course we are an international Swiss-based agency, but we work with the local capacity and build on that. And just to give an example from my recent trip to the Rohingyas camp in Bangladesh, you know, the Rohingyas are being kicked out, and if you hear the gruesome stories of you know, how the family members have been killed, women have been raped, and they've just barely been able to save their lives crossing into Bangladesh, one of the poorest countries in the world, as you know. And then, so they don't get any identity and recognition in Myanmar, even though they've lived there for decades. They end up in Bangladesh. Bangladesh government is temporarily giving space, but doesn't want to help them either. So they don't have any recognition, and to go into a camp like that where, for example, we do clinics, and now tailored also to COVID-19, we do nutritional programs, to then actually train Rohingya refugees and to help them to respond. And one person I met, Mohamed, who then, and he was basically doing a simple job, and we trained him. But you know, the fact and the response for him, he said, now I can see a bit of my dignity back, because I'm taken serious, I'm helping my community. And yeah, the investment of people in people, and for us that is at very local level as an NGO, very much working with local capacities. And yeah, the numbers, as I said, 3.5 million, but for every individual, it's a world of difference if they can get that support, if they can receive that training.
Yeah, thank you very much. Marianne, you had a question. Please go ahead.
Thank you, Eckhard. Well, thank you, both of you. These were great remarks, and you provided some really valuable insight. Michael, I have a question to you that regards funding. As far as I know, almost all of the countries that the Global Fund is supporting are required to increase their domestic investment in health systems. And I'm wondering how it is possible for an organization, agency like the Global Fund to support countries to invest more in public health governance processes. You just have mentioned in your presentation that within the COVID-19 response, countries started to buy commodities. And this has been practiced in the past, that countries would use the money to buy health commodities. So how can the Global Fund be innovative to support countries to not only focus on commodities, but on the governance process themselves to support building up resilient health systems? And I find this particular concerning if we look at the replenishment of the COVID the Global Fund, which is about, I understand, about 1 billion right now for COVID-19. There might be a risk, right, to defund certain activities that the Global Fund already planned to fund in the future. Could you elaborate a bit on how sustainable financing could be strengthened within the Global Fund in the course of this response to the pandemic?
Wow, that's quite a complicated question. So I think they're two separate issues. One is around domestic spending on health. So I do think there's going to be a challenge, not immediately, but in the medium term for increased spending on health because the entire economy is going to contract. It's going to be particularly problematic in countries that have health insurance because of massive unemployment. So there are going to be big fiscal challenges, but probably not in the short run. There'll probably be increased budgets going to health. I mean, we've already seen that in India and Pakistan, for example. In terms of donor assistance, I actually think that more money will probably flow into the Global Fund for COVID. So I don't think it's a trade-off. So I think that as somebody mentioned already, like for the ACT initiative, I think there'll be increased funding available. I mean, it is still an open question of how much that's new money, but I think some of that may end up in the Global Fund as well, particularly in the area to support diagnostics, which I think is a good thing because the issue around some of the key commodities for COVID is not about money, it's about the supply chain and providing guarantees to suppliers upfront. So I think that is very helpful. But I do agree with you that in the long term that there needs to be more domestic financing in health. And one of the things that the Sustainable Health Financing Accelerator had been working on was trying to think much more about that subject and how we could work together more effectively, particularly in countries that have low health spending or low public spending on health. Usually, half of the Abuja target, less than 8% of government spending on health. And that's a lot of countries and most countries in Africa. So health is not prioritized, and hopefully COVID actually might change people's views about that, actually, about the need to invest in health. So I do think this is, sadly enough, also an opportunity.
David, what's your view on this? I mean, do you want to add something to that from your perspective?
No, nothing to add. Thank you.
Okay. Thanks. So we had a couple of questions here that came in from our community regarding digital tools. I mean, for those of you who had joined us last week, you know that we had a longer discussion with some experts on privacy versus health, and it seems to be this is a question that comes up regularly in this type of debates. And so I would like to get your views on it. To what extent this is actually something that's on your agenda as well to basically help countries to develop their own tools in terms of tracing infection rates and maybe in a sense of not necessarily preparedness, but possibility to mitigate the outbreak of the crisis, to have some additional tools besides vaccine and medical supplies.
Yeah, from our side, as I indicated, this project in Lebanon that we are also now trying to roll out into other countries. It was already started before this outbreak, but now it's extremely helpful. And basically, the whole tracing, well, first of all, it's the localization with drones, but then once refugees have a location, a P code where we know where they are through GPS, then we do assessments, and this is all done through what is called ODK. It's all on smartphones, basically, and the data is immediately uploaded and then centralized and mapped and given to UNHCR. And so now it's also used for COVID-19 cases, for knowing what clinics, where the outbreaks among the refugees are higher, because this is in the Becker Valley, so it's a huge area. And yeah, these are incredible important tools. And our IT director was saying, both internally as well as these tools that we use for beneficiaries, that now COVID-19 is really giving us a push to digitalize more and to really see these innovations being used and being multiplied in many very useful ways.
Okay, thank you. Michael, what's your experience from the Global Fund?
Well, yes, I think we're very interested in that. I mean, what I would say is that generally what are often referred to as NPIs, non-pharmaceutical interventions, are the most important interventions in COVID, particularly in low and middle income countries. So that includes contact tracing and as well as social distancing. So obviously these are critically important, and one wonders if we cannot do more leapfrogging in low-income countries, particularly because the epidemics generally will start, from port of calls and people who have cell phones who are coming in from outside. So potentially, I think there is a role. I mean, we asked some of the people that we work with who've been working on data to do that. I don't know if you've like different groups like Genesis and Blue Square and stuff like that. But I have to say we haven't had that much take up at the country level. So I think that sadly enough, I mean, obviously we have to work through government counterparts, and we propose making this available and funding, but they haven't really taken us up on the offer, I have to say. So.
All right, thanks. So I have another question from the floor. Michele, do you want to raise your question yourself? Michele,
hello. Thank you for giving me the floor. My question was about the general approach. It's evident that global approach it's not applicable everywhere because on different context and situation. So what I would like to ask is first, are in your experience see greater cooperation between countries in terms of pandemic? And the second, whether we have a vaccine, how we can help everybody to get the vaccine to spread globally. Thank you.
Thank you, Michele. Who wants to respond first?
Well, sadly enough, I don't think we've been seeing countries collaborate. I think the UN system and the global system, at least parts of it, seem to be working reasonably well, definitely better than Ebola. And I think WHO is performing better than Ebola. But I'm not sure we're seeing a lot of cooperation across countries necessarily. So.
Yeah, I agree. It's very unfortunate. I think there's a lot, well, you could call it silver lining in this crisis. And you see in countries, people coming together, people supporting the health workers. There's a social responsibility, social care. And even though people have to be distancing from each other, there's a lot of reaching out virtually or online. But I agree with Mike. It's very unfortunate that sometimes politics can come in and the support, and of course this differs per country, but there is a lot of opportunities now to work together and to help, and for us, and I guess Global Fund the same, we are very much highlighting the plight of the countries that don't have the resources, don't have the capacities to respond, and they need the solidarity from the countries that have those capacities to overcome this crisis. And as well as you said, once the vaccine comes out, let's hope it's going to be distributed equally. I think it was Günther that said, we're all affected by this crisis. There's no one accepted, and so it's the weakest link. It's everyone that we need to support, and a crisis like this doesn't discriminate, and so we need to also apply and support everyone in equal measure.
Absolutely, thank you, David. I have a question from Paul. Paul, do you want to raise it yourself? Paul, are you still with us?
Sorry, I was on mute.
Okay, great.
So thank you very much. Thank you very much, David and Michael, for providing actually the insight about both your activities. I have a question that actually rebounces from the initial question that Eckhard was asking related to pandemic preparedness. I'd like your perspective on how you actually foresee the current pandemic situation reshaping global democracy. We've seen that actually, unfortunately, in a lot of democracy, things are not working out because there's miscommunication. There's actually decision being taken differently from country to country, even if they're close to borders. and also relating to shaping the global governance, and whether some higher instances such as the NGOs, such as Medair, Global Fund, or even United Nations should actually lead and probably act more predominantly and provide more governance and maybe impose. I don't know whether United Nations can impose, but at least to provide more, I would say, consolidated and community-wide governance to governments, so that people can act as a, I wouldn't say as a single vote, but actually actively, whether without the borders, without the frontiers, without actually saying that I decide on this way and say I'm just closing the borders. So because we've seen, unfortunately, that nowadays the democracy model may not be working, and it probably will change all the government's leaders.
That's quite a provocative question. I mean, I would like to get both of you answer to that question.
Wow, that is quite. I think they're making a lot of assumptions there. Let's just think about it for a second. Like, what country has been the most successful in controlling the epidemic? New Zealand, which is like, okay, they have a lot of sheep, but it's also a democracy. So it's not just authoritarian countries. And Korea, I mean, is not an authoritarian country either. And I mean, and they did quite a good job as well. So I don't think that we can really completely generalize. Like, Korea is very interesting because they experienced MERS. And one of the reasons that they did such a good job is that they had prepared afterwards. So I don't think it's exclusively about, which type of political system you have. I think I will say that I think decentralized systems are going to actually find it quite difficult. And I think that one of the lessons from the decentralization, like for example in Pakistan and in Indonesia, is that there'll be more re-centralization that comes because in order to have pandemic response, you need a functioning command and control system when a crisis comes. So, but I don't think that's necessarily exclusively related to whether you're a democratic or whatever the classification might be, actually. Though I will single out countries that don't have an effective state. So if you don't have an effective government or state, we talked about that with refugee camps, then that's like a whole different story, and that is where the international system plays a critical role.
Thank you. David, what's your experience?
Yeah, just to add from my side, and it's probably a civil society perspective, but I think it's an opportunity now with COVID-19 also for people to have people movements, to have bottom-up movements. And I guess you're familiar with this concept of new power, how to, in a new hyper-connected world, through social media, how complete movements, especially among youth. We've seen it with climate change. We've seen it with other movements. And these are influencing governments. These are influencing the world. And let's hope that also out of this COVID-19, that there is a movement of solidarity, of support. And that, as we already mentioned, for governments, it's often difficult to innovate because of the bureaucracies, the challenges they're facing. But these innovations can come bottom up from civil society, from these movements, using the new technologies. And I hope as we have seen, and people have said, this COVID-19, there will be a world before it and a world after it. And so what's going to be the new normal? And our hope is, and definitely we are supporting that and being part of it, is that we will see a new movement of solidarity and support across boundaries, borders, and nations, so that we can better respond to a crisis and a pandemic like this in the future.
Yeah, I think that's a great way to close this discussion: solidarity and innovation from different stakeholders. I think I would agree with you on that one. I'm sorry, I think we are almost at the end of our webinar, and I want to thank both of you for this really lively and active discussion, and to our community, obviously, to share their thoughts with us. With that, I would hand it over back to Renate.
Thank you very much, Eckhard. Thank you very much, everybody, for this discussion. I found it really engaging and interesting. As I said before, we will publish the recorded webinar later this week. Thanks so much for all your questions and comments. Special thanks again to our distinguished speakers. Please join us again next Wednesday, as we're having a series of weekly online talks now, all related to the pandemic. Next time we will talk about how the virus impacts the labor market, and the week after, how the virus hits the financial markets. And we will have some interesting speakers. Some of you might know them already. Dr. Thomas Moser from the Swiss National Bank and Dr. Ralf Chami from the IMF. So I'm going to share my last slide now in order to show you how you can stay in touch with us. We have a new website. Thank you very much, Robert. We have a new URL how you can reach us. So please stay in touch with us. Give us feedback on our webinar, comment on our posts on LinkedIn, and discuss with us in our forum. Also, if you want to become a member of the Geneva Macro Labs or suggest a topic that we could cover, please let us know. We look forward to hearing from you. I wish you all a pleasant rest of the week. Stay healthy and talk again, hopefully next Wednesday. Goodbye for now, everybody.